Well, I think you need a system. And I don't think that my system is perfect, but I think you need a system that a person starts from the beginning from an investigation and goes through the different systems. So where some people might test mold right off, I don't test mold until someone has enough glutathione, because then the mold numbers will be accurate. Same thing with heavy metals, right? So typically, if you look at some of the research, like Dr. Richard Deeth, he had a study where they actually looked at the brain tissue of people diagnosed with autism, including children who had unfortunately passed away. Their brain was 3 times lower in B12. So it's like, well, if you don't have B12, then 200 other cycles in the methylation cycle and the biochemistry of the body aren't working. So if you supply B12, it's like getting the process started, right? If kids are having any visual symptoms, including like lack of focus, spinning, side glancing, lining things up, the more classical ones, lensing in and out, like anything with their eyes, you give them vitamin A, it usually starts to integrate the vision. So then you should sort of start moving forward. Then the testing is more accurate. So I usually start with like a bowel x-ray, see what's happening with this gooey, sticky mess. And then depending on if I'm seeing sand come out or the parents are seeing sand come out, then maybe we're testing mold. If kids really aren't moving, then I'm like, okay, well, maybe there's lots of metals because those kids move slowly. It's great to get microbiome testing just to figure out, who's living in there, what are the good bacteria, do you have bowel inflammation, if the steatocrit marker in the microbiome test is a marker for small intestinal bacterial overgrowth, so that's a good thing to know. And then a good case history will tell you typically if there's congenital Lyme. So that's when you give them the Horowitz or the Dr. Arman co-infection checklist, and you're looking for things like, sweating, stretch marks, lots of skin stuff, acne, boils, joint pain, shooting pains, extreme fatigue, and you're looking through the whole family. PANDAS is also familial, so usually with PANDAS you'll find someone else in the family who's got something, or like you've got the mom who's had strep 20 times and the kids has never had strep, right?
Could you explain a bit about PANS and PANDAS?
Yeah, so Dr. Susan Sweeto many years ago proposed that strep, the bacteria, could actually trigger an autoimmune attack on the brain, and she had these really extreme cases where you had these neurotypical kids who just woke up one day with extreme OCD and rage and tics, urinary accidents, regression at school, like in handwriting or academic performance, and they had all these intense behavior, separation anxiety. And so it was like out of the blue, and I've had these kids too, and it's wild, and it's so traumatizing to the parents because they have one child one day, and then after an infection they have another child, and typically they're told it's psychiatric, so then it's further traumatizing, which is maybe a whole other interview. But it's not just strep, it could be yeast, it could be mold, it could be Coxsackie virus. I've had any virus or stressor or toxic can trigger an autoimmune attack on the brain. And so I think a lot of our kids have it.
보충 설명을 조금 더 하자면 뇌의 기저핵 부분에 자가면역 공격이 일어난다는 건데요. 면역세포가 코 신경으로 들어가서 BBB를 통과해 기저핵 부분에 염증을 일으키고 뇌신경도 손상시킬 수 있다는 겁니다. 기저핵이라는 곳은 운동 조절이라던가 인지적이거나 정서적인 반응들, 또 절차적 학습이라고 하는 이렇게 반복해서 연습하면은 무의식적으로 할 수 있게 되는 어떤 그런 자전거 타기라던가 수영, 춤 같은 그런 기능을 담당하는 곳입니다. 그래서 이곳에 손상이 있으면 파킨슨이나 틱, 또 이제 디스프락시아 같은 운동장애나 협응장애가 일어날 수 있고 감정 조절 등의 문제도 생길 수 있습니다. 그래서 펜스 앤 펜타스의 주 증상이 갑자기 글씨를 엉망으로 쓴다라거나 아니면 협응 문제나 틱 같은 증상이 나타나고 강박이라던가 화를 잘 내는 그런 감정 조절의 문제 등이 있습니다. 그런데 이 중에 많은 부분이 자폐 증상과 겹치잖아요. 그래서 자폐인 줄 알았는데 알고 보니 펜스 앤 펜타스였고 치료 후 회복되었다라는 케이스들도 보고되고 있습니다. 그래서 이제 그 자폐와 펜스 앤 펜타스의 차이에 대해서 질문해 보았는데요.
I don't think it's easy. Like I think that there's panels, like there's the Cunningham panel. Dr. Sweeto herself, when I asked her this question, she had recommended like a neurological test, like the Romberg test, where kids stand with shoulder width apart and then they stand with their hands straight out in front of them with their eyes shut. Obviously, for a lot of our kids, that's difficult. I think you check off the list as you go. And kids with PANDAS, they'll start getting behavioral regression or aggravations like in the spring and fall, or they get it when they get sick. Instead of getting sick, they get behaviors, they get scared, they don't sleep. Yes, but like foundationally, they have to start at the same place because whatever bugs are in there are living in the biofilm, and that's stuck in the gut. So the only difference between a complete PANDAS case is you might get further into recovery because once the bug is gone, that those kids probably recover more completely if you can fully treat it. But they're also way more up and down. Yeah. So we actually, interestingly enough, so my older son has PANDAS because again we're a microbial family, so we discovered that we have congenital Lyme and the co-infections that go along with that. So Magnus, as I mentioned before, regressed when he was 16 months, and my older son has PANDAS. So we would do this Romberg test periodically because the intensity of the behaviors is pretty like next level. So we wanted to make sure, if it was PANDAS, you can't discipline a child for PANDAS, right? Even though the behavior can be quite shocking and hard to manage anyway. So in the beginning, for me anyway, I treat, modified ketogenic diet, super strict, B12 injections whenever possible, a high dose autism multivitamin with enough like B6 and manganese, which you need for Lyme, and molybdenum and selenium, and some vitamin A. The cod liver oil is omega-3, which is anti-inflammatory. It's omega-7 with the palmitic acid, which is anti-inflammatory. And then the vitamin A is 14-hydroxyretinol, which is going to fix the eyes the fastest. And then it has vitamin D in there. And then the bowel clear oats. So after that, whether it's heavy metals or mycotoxins or Lyme or strep, yeast, you're ready to treat it. And then that would become more individualized.